Hello and welcome back. I hope you all enjoyed my first video called Rotator Cuff 101, the 5 important facts you needed to know about your rotator cuff. In that video I set the stage for conversations that we're going to have today. Essentially I made the point that all patients get rotator cuff tears and that rotator cuff pain is abnormal. Those are two important things to think about. The other point that I made was most patients, we can get better with physical therapy for their rotator cuff. So that being said, there's a role for surgery for rotator cuff tears, and I think it's important to differentiate who is a good candidate for surgery and who is a good candidate for physical therapy and how we make that decision. So I'm going to lay out the framework for that, and I hope this can be helpful for you in your life and with your shoulder pain. The first and obviously most important thing in terms of getting this right is getting the right diagnosis on the front end. This is usually done in the hands of a skilled musculoskeletal provider or potentially your family medicine physician, but establishing the diagnosis of a rotator cuff tear is the most important first step. I see a lot of patients who have a history of frozen shoulder, shoulder dislocations, previous shoulder surgery, and shoulder arthritis. This goes into a totally other category that's separate from rotator cuff tearing. And rotator cuff tearing deserves its own category itself. The main way that we make the diagnosis of rotator cuff tear is pain and weakness with the arm in the rotator cuff position, which is up and out like this. So we test it this way. But again, this is really important to have a skilled provider do this examination so we can make the right diagnosis up front. If the pain seems to be related to the rotator cuff, then you'll follow this pathway. If not, we'll do future videos to describe treatment for frozen shoulder and arthritis and other issues like that. So let's say we have the diagnosis of rotator cuff tear. We've not yet got an MRI scan, but we've had pain for some time. The first distinction we make is whether or not it's an acute or a chronic rotator cuff tear. Acute rotator cuff tear is the result of an injury. You've fallen down the stairs, you've gotten in a car accident, or you've had your arm pulled in a different direction. Acute pain after an injury diagnosed an acute rotator cuff tear. These go in one category. The other type of diagnosis is a chronic rotator cuff tear. This is pain that has been gradually and slowly growing. No specific injury, just gradually building over time. It can be equally painful, but no specific trauma or event that caused the pain. The chronic rotator cuff tears, the treatment is very straightforward. We start with 6 weeks of exercises. This is physical therapy done on your own. We don't even need to get an MRI out of the bat to get this diagnosis. The acute rotator cuff tear falls into a different category. These people, patients who've had an injury, I would recommend getting an MRI. This gives us an idea of the cuff tear pattern and size. Acute, full thickness rotator cuff tears are ones that involve the full thickness of the tendon. It's not all the tendon, just the full thickness of the tendon in one location. And I would recommend surgery early, within 6 weeks or 3 months, after an acute, full thickness rotator cuff tear in the vast majority of patients. Acute, partial thickness rotator cuff tears can be treated with non-surgical management too. Now, the chronic rotator cuff tears are another category entirely, and these tears typically can be treated without surgery. There's good data that shows up to 80% of these patients can have substantial pain relief and go back to essentially normal with physical therapy. So that's the first line of treatment for this. If, however, after 6 weeks or 3 months of physical therapy, the pain persists, an MRI is important. If an MRI demonstrates a full thickness rotator cuff tear after failed exercises, even in the setting of a chronic tear, I typically recommend surgery. It's an arthroscopic rotator cuff repair where we put the tendon back down on the bone. Healing is reliable and the outcomes are outstanding. Some people continue to advocate for injections, and there are certain indications for an injection, but I think the indications are getting smaller and smaller. And there is some data even that injections can be harmful to the rotator cuff. They can increase the size of the tear. They can make it more likely to get an infection if you eventually get surgery, in particular within 3 months after the injection. To summarize, Acute rotator cuff tears are those that happen after an injury within the last 3 months. Chronic rotator cuff tears are those that slowly happen over time. Acute rotator cuff tears warrant an MRI scan. If you have an acute full-thickness rotator cuff tear, in most cases, I would recommend surgical management. Acute partial-thickness rotator cuff tears and chronic rotator cuff tears can be treated without surgery with physical therapy. In this case, we monitor the response to physical therapy, and if it's not getting better in 6 weeks or 3 months, then we could consider surgery. Injections are becoming less and less common for rotator cuff tears because they can substantially increase the size of the tear and contribute to long-term infections over time. Most importantly, getting the diagnosis right on the front end of a rotator cuff tear is critically important. So that's why you need to get plugged in with a skilled provider who's seen patients with shoulder pathology over time, either your primary care doctor, an orthopedic surgeon, or sports medicine specialist. I hope this helps clarify some of your questions. I'm sure there's more questions where that came from. Connect with me below, and I'm happy to address those as much as I can.